don't, at present, in Canada and in many other places of the world, consider mental health as on any kind of par or equivalence with other types of health, including sexual health and physical health. So there are not the same kind of resources, community engaged programs or services for anybody. And then on top of that, you put the unique and particular experiences of 2S LGBTQ+ populations, which often are dealing with having to kind of hide or run from or escape violence, discrimination, stigma on a daily basis, if not an hourly basis. And the pressures of that on top of our 2S LGBTQ+ populations is tremendous. And there's tons of fantastic research that has shown that over the long term of trying to live an authentic life as a 2S LGBTQ+ person, that as you try to live that authentic life, it takes a tremendous amount of burden. It's a tremendous burden, and it takes a tremendous amount of energy and support and love and caring and clinical care often to help people to gather the resources and supports they need in order to take good care of themselves. And so the access to care, there's not enough. There's just simply not enough. And I think for 2S LGBTQ+ persons, one of the first things that people want to do, even if they get to the point where they recognize, I am struggling with anxiety or depression, which is not always easy to recognize and know that something's not right. I think it's getting better, which is great. But then knowing where to go or who to talk to. We have, in some of our studies, we have seen people who live way outside of, I'm in Toronto. There are queer 2S LGBTQ+ resources in Toronto. You have people who live far away. They'll drive past 7 or 8 or take the subway past or bus past 7 or 8 other healthcare community healthcare centers to get to one where they know that they don't have to have a conversation about, I'm 2S LGBTQ+, and I need to know that you're okay with that. So the dependency is on the person who's seeking this care and service, as opposed to the person providing it just being like, you're part of the human family, and so how can I support you? So I think there's just not enough access at all, and there's certainly not enough real specific access that addresses that kind of isolation and, I mean, really what we call minority stress upon our 2S LGBTQ+ folks.
Thank you.
Why is isolation important to mention when we want to talk about mental health for 2S LGBTQ+ populations? My answer to that is primarily that most people, when they recognize that they don't fit into a cis heteronormative identity, or they're not having that experience, often start from a place of, I'm the only one. Even though we have more examples of people who are out in terms of celebrities, television shows, characters, even so, people are not necessarily connected to those people. So there's immediately a sense of, am I the only one? Do I have anyone else that I can talk to about that? And unless you know you're in a very safe place where someone is going to be affirming of who you are and who you are to be, that isolation it's almost kind of self-protective. It's a way to kind of say, to take care of oneself, to not take the risk of, I'm going to come out to someone, or I'm going to share my gender identity, which maybe looks different from how people have seen my gender identity. To go and share that, that's a huge risk. So instead of taking that risk, people may then choose to just kind of isolate as a self-protective factor. So, I mean, we don't want to put the burden back on our population, but that's part of what happens when there isn't a system that's sitting there going, come, you're welcome. Bring all of you here, and we will make sure that you get the care that you need and you require. How can different organizations, community organizations, and service providers help to support meaningful connections for 2S LGBTQ+ people? Yeah, I think actually the longer I've been in this field, which is, you know, a few moons now, the more I realize that actually that should be the primary role of our providers, is figuring out how to connect people with other people who are experiencing what they're experiencing, with people who maybe are mentors in a sense, that they've had some kind of experience that they can share with them and support them, where they're getting loving and affirming health care, sexual health care, physical health care, mental health care, emotional health care. You know, all of those components of being a human being, even spiritual health care as well. That people have a place where they know that they feel safe to do that. So I think actually the greatest, the largest responsibility really falls on those providers to ensure that they're providing that kind of care to people that is welcoming. And welcoming sounds like, oh, the door's open, come on in. Maybe I mean something a little bigger than welcoming, in the sense of really, really very deeply grateful for someone's lived experience and wanting to support and provide them with the most affirming and transformative care that they can receive. The fact that I have been a consumer, I have dealt with depression and anxiety for a lot of my life as a queer person, and I look back, even just very recently, kind of thinking about where I've gotten good care, and it was primarily from people who immediately either understood that I was a gay guy, for me particularly, cis guy, and immediately sort of understood that either they could provide that care or they would recommend someone else who could, and which is fine. But I think the fact that being able to access care and having the privilege to access care that I needed at various points in my life to ensure that I was, quite frankly, still alive, was very, very central to my own lived experience as well. So I think it's kind of critical that we do this work.